Good evening, everybody. And I suspect there's a lot of people who enjoy drinking coffee in the audience tonight, probably driven by the taste and or the stimulant properties. And you may also be aware that moderate coffee drinking could be good for your general health, and particularly it could be protective over the health of your liver. Now that's really important. It's important because deaths from liver disease have continued to increase over the last 30 years or so in the UK, driven by two main lifestyle-related factors: one, alcohol, and two, fat. And if someone is obese, they're bound to have some fat in their liver. And that fat can become quite toxic, leading to inflammation, scarring, and even liver cancer. The trouble is there aren't really many great treatment options for fatty liver disease, other than diet, exercise, weight loss. So wouldn't it be wonderful if future health advice could include drinking just a little bit more coffee? The trouble is most existing research comes from observational studies, the kind of studies where people are simply asked how much coffee they drink. No one's done an experimental study to see if increasing amounts of coffee in people with established liver disease could reduce the risk of the disease progressing. Now is that time, but not quite. There remained a couple of knowledge gaps. Hello, research degree. The first of those is, would giving coffee to people in an experimental study introduce additional non-liver harm? To address this question, I conducted an umbrella review, or review of reviews looking at coffee drinking in relation to any health outcome. And this included over 200 existing reviews across 67 health outcomes. The great news was that coffee was more frequently associated with benefit than harm outside of pregnancy. Next, would people with established fatty liver disease feel able to drink any more coffee than they already do? And what would they think about our future research plans? To address this question, I conducted a postal survey of patients with fatty liver disease recruited through 3 NHS sites, and I received 400 questionnaires back. In the sample, 3/4 were current coffee drinkers, and nearly 90% said they could increase their coffee drinking by 2 cups a day if advised by a healthcare professional. Perhaps even more extraordinary were the non-coffee drinkers, half of whom said they would start drinking coffee if it was good for their liver health. The idea for the research was generally seen as very acceptable. So in summary, we think coffee could be good for the health of our livers. We need an experimental study to be sure, and due to work done in my research degree, now is the time. Thank you.